Welcome all. Today we are going to see a topic lipoma in the chapter of swellings. So first, what is lipoma? The word lipoma itself contains lipid in the sense fat. So it is a benign neoplasm arising from the yellow fat. From the yellow fat, a benign tumor arises and it is known as lipoma. So this is often due to the hyperplasia of the fat cells, increased multiplication of the fat cells, and this lipoma, consider this is lipoma, and it is made of mature adipocytes, and these adipocytes are all identical, and it is also identical to the normal adult fat cell. It resembles the same structure of the normal adult fat cell. It has no anaplastic changes, and it contains mature adipocytes. So next, generally fat is utilized in metabolism when glucose is not present in the body or glycogen is deficient in the body, but in these cases the fat in the lipoma cannot be used for general metabolism, and it is the most common benign tumor, and it is called as universal tumor because it occurs everywhere in the body except in the brain, so it is known as universal tumor. So next, lipoma can be localized or diffuse, superficial or deep lipoma, single or multiple lipoma. So the first classification is localized or diffuse lipoma. Localized lipoma in the sense it is confined to a space, so it is covered by capsule, it does not spread, so it is covered by a capsule, it is encapsulated, and normally fat is yellow in color, it is yellowish orange in color. And next is diffuse. Diffuse in the sense there is localized increase in the subcutaneous fat to a large area without any distinct capsule or covering. So it is not encapsulated, it is not covered by a capsule, and it occurs in palms, soles, head and neck, and also in subcutaneous and intramuscular tissues. So this is the first classification. Localized is encapsulated and diffuse is not encapsulated. Where it occurs is the second point. And next, about the superficial ones. So first, superficial and deep lipomas. Let's make it as a comparison. So the common site is subcutaneous plane in superficial lipoma, and here it is intramuscular. So first, superficial lipomas are common in subcutaneous plane because subcutaneous plane is the superficial one, and intramuscular is the deep one. So deep lipomas are common in the intramuscular region, and here there is no gender predisposition, and here it is common in men. So this is the second point regarding the gender. And next, about the common sites, it commonly occurs in back, neck, proximal extremities and abdomen. Here it commonly occurs in lower limbs and trunk. So this superficial lipomas are less than 5 cm in size. So this is the fourth point, this is less than 5 cm in size. These deep lipomas are larger in size. So there is totally 4 points. It is more common in subcutaneous plane, it is common in intramuscular plane. This is the first point. Next one is there is no gender predisposition. Here it is common in men. This is the second point. Third, common sites, back, neck, proximal extremities and abdomen. Here lower limbs and trunks are the common sites. Size, it is less than 5 cm in size, and here it is larger in size. So next, coming on to the single and multiple lipoma. So single lipoma is common generally, and multiple lipoma is common in males. Single lipoma is a superficial one, and multiple lipoma usually occurs in back, shoulders and upper arms. It is symmetrical lipoma, and multiple lipomas are usually associated with multiple endocrine neoplasia, Froehlich syndrome and Cowden syndrome. So multiple lipoma in the sense of area contains multiple masses of fat tissue, containing fat tissue, that is lipoma. So next one is regarding multiple lipomatosis. Multiple lipomatosis is the diffuse overgrowth of mature adipose tissue, and here it involves subcutaneous and muscular plane. It is common in younger age, shoulders, pelvic girdles. So sites of lipoma. Sites of lipoma is, first remember, subcutaneous and subfacial. First is skin and then fascia. So subcutaneous and subfacial. Three things: subserosal, serosal layer, mucosa, and osteal, bone related. Subserosal, submucosal and perosteal regions. Intraglandular, within the gland. Intramuscular, intermuscular, subsynovial, subperiosteal. So the clinical features include: it is a localized swelling, and it is lobular and non-tender. It is painless swelling, and it is confined to a lobule, and it is localized to a particular space. And here it is non-fluctuant and non-transilluminating. Slip sign is positive. Slip sign is in the sense edges slips between the palpating fingers, and it is mobile. Skin is free. Lipomas are not adherent to the skin, and it may be pedunculated at some times. And if there is nerve compression, if the lipomas grow in size and it compresses the nerve, pain is present. The most common site is the trunk, and next common is the nape of the neck and the limbs. So the clinical feature, first one, it is a localized swelling and it is lobular and it is painless swelling. It does not fluctuate, it is non-fluctuant, and when you pass light into the swellings, it is not translucent or transparent, so it is non-trans-illuminating. So differential diagnosis include 4 things. First one is neurofibroma, cystic swellings, maybe either dermoid or sebaceous cyst, and liposarcoma and other soft tissue tumors. These are the differential diagnosis. And the investigations include either you can take an ultrasound, CT or an MRI to visualize, and FNAC or incision biopsy to confirm whether it is a malignant one or a generalized lipoma. And next is the complications. Complications include myxomatous changes in the retroperitoneal lipoma, saponification of the fat, and calcification. And submucosal lipoma can cause intussusception and intestinal obstruction. So there are 4 complications. The first one is myxomatous changes, and the fat in the lipoma may get saponified, so saponification. The fat may get calcified, so calcification. And if it is present in the intestines, submucosal lipoma occurs. It can cause intussusception of the intestines, that is telescoping of the intestines, and intestinal obstruction may occur. Treatment is excision of the lipoma. Thank you for watching. If you like this video, share this to your friends and subscribe.